Show, and in this segment of our program we will talk about the recent developments related to coronavirus or COVID-19 pandemic. We'll try to know more about the vaccines and their effectiveness, and we are joined over the phone by Dr. Ramy Aziz, Professor of Microbiology. Good morning, Dr. Ramy.
Good morning. How are you doing?
Good, sir. So first, sir, let's talk about coronavirus and the third wave that is currently taking place in the country. What is the difference between this wave and the waves we saw before?
Well, I'm not a person who calls this a third wave. So, so the common name in the world, most of the media is calling this a third wave worldwide. But in Egypt, in my opinion, we have never gone out of the second one. I know it's not very important to discuss whether it's a second or a third, but the important thing is to say that the virus has not changed much. What changed is human behavior. This is a very key point, because we cannot say that the virus is more dangerous or less dangerous or anything like that. What changes is that probably people either got very tired or, they don't have enough patience to stay more indoors. So now we have an explosion of cases. And this is what matters. We have to adjust human behavior and be careful again like we did last year.
So, Dr. Ramy, you believe that what has changed is human behavior, not the way the virus is spreading. It's the same way as before.
Yes, most likely this is true. So the dynamics of any epidemic is that you get a lot of cases, so people get afraid and stay home, so the cases drop, and then they relax a little bit, and there is always a gap of 2 weeks. So whenever you do, if you do a lot of gatherings, after 2 weeks you will see the consequence.
Yes. So, sir, if we talk about the vaccines now, and we can all see that many people are hesitant to take the vaccine, and rumors that go around that AstraZeneca will cause blood clots and it's not safe. How do you see these claims, and what is your advice to all the people in particular who are still hesitant to take it?
Yes, thank you for this question.
Yes.
I totally understand that people are hesitant. This is understandable. Humans always are afraid of something that is unknown to them and that is new. So it's understandable. I don't blame anybody for being hesitant. However, I encourage everybody to take a vaccine as soon as possible. And I started by myself. I have had my first dose and I'm waiting for my second very soon. So any vaccine, anything that you take in your body will have a probability of side effects. So far the vaccine that you mentioned of AstraZeneca, there has been serious claims that there is 1 in a million or sometimes 1 in a 200,000 cases. 1 in 200,000 people may get a blood clot. So there are two arguments here. One is that this is the normal probability of getting a blood clot. That's one argument. The opposite argument is that perhaps this is caused by the vaccine, but there is no answer yet. It has not been proven that this is because of the vaccine. But even if it's because of the vaccine, the authorities, the drug monitoring agencies always check the age groups. So currently the warning in Europe is only to be careful for the age group between 30 and 50, and especially for females. And it's also treatable. So it's treatable by immunoglobulins and by corticosteroids. So I want to say that the danger of not taking a vaccine is much higher than the danger of having a side effect that is very rare.
Yes. So, sir, which gives more immunity to the body, the herd immunity or vaccinations?
So the herd immunity is not related to, it's not comparable with vaccination. This is the same thing. So herd immunity is not related to one human, but to the whole population. We get herd immunity in a population by 2 ways.
Yes.
Either if more than 75% of the inhabitants get the disease and get immunity, or that they get vaccinated. So it's not opposite. Either vaccine or disease will offer immunity. However, even people who have had the disease, they are advised to take the vaccine as soon as 1 or 2 months after the first symptoms. Because you always need, even when you take a vaccine, you usually need a second or a third dose. We call it booster. So it was shown scientifically that people who had the disease and they take only one dose of the vaccine, they are very fine. Most scientists say they don't need their second dose. But having the disease only doesn't offer the same level of immunity, because you always need an encouragement or enforcement to the immune system to produce more immune cells and more antibodies.
Yes. Sir, there are also some claims that are circulated on social media that maybe the vaccine will show some side effects after 2 or 3 years. Is there any scientific base for this, especially those who are depending on the RNA and these claims?
Right. So first of all, the scientists always speak in probability. They always tell you 1 in 1,000, 1 in 1,000,000, etc. But in the past, for any vaccine, there has never been delayed side effects. Like no vaccine has been shown to cause cancer, for example.
Yes.
However, in the past, in the very early age, and maybe many years ago, sometimes there were impurities in the vaccine preparation. But this is very old, because now the technology is much higher. So sometimes the impurities in the vaccine could lead to some effect. But for the vaccines that are made now, they are very well monitored. The whole world is monitoring them, and all the press. So all the companies are very careful about their preparations. They go through so many steps of quality control.
Yes.
So there is very, I want to say, very close to impossible to have something that is long term. Even the story of the blood clots, they happen within 10 or 15 days of the vaccine. So always the vaccine effects are always very soon. Usually the only risk of a vaccine is developing an allergy or hypersensitivity reaction, and this is usually very quick. It doesn't wait for so many years.
So, sir, you believe that still now the vaccine is the safest way to counter coronavirus, despite all these claims?
Definitely. If you look at the epidemiology curves from England, for example, which is a country that's vaccinated, I think, over 40 million or maybe more, there is a real drop. Even the U.S., which was the highest country in the world for very long, like almost a full year, it was the highest country. Now it's stabilizing.
True.
Many other countries, you can see the vaccine effect. So I hope we can all. As I told you, I started by myself, so I'm not giving an advice that I didn't follow.
So, sir, you believe that any available vaccine, not a special one, any available vaccine should be used immediately? You don't recommend?
Sure, any available vaccine should be used, but you always have to talk to your the doctors in the vaccine facilities are very, very nice and very well informed. So you should tell them all about your health, because some cases and some people taking particular medicines, immune suppressants, the doctor will tell them, no, you should take this vaccine, but not the other one. And they always have possibilities. Or they may tell you, no, come after a month.
Yes.
If you have had a very recent infection. So you always talk to these doctors, and they have very good information.
So, sir, how do you describe the situation in India these days, as it is very alarming? Do you think that a mutation of the virus took place there, or it is again people's behavior?
Yeah, thank you for the question. Again, of course,
yes.
Everybody has slightly different opinion, because this is very recent. It's something that happened all of a sudden. But again, I belong to that school that says it's first human behavior and then virus. So the major thing is human behavior. It's more like the chicken and egg, you know. So if you relax the safety measures, what happened in India probably is they had a lot of cases last year, and most people thought, okay, now we almost reached herd immunity. We don't need to be as careful, and they started also a lot of. And India is a country that is very crowded and very dense. It's very similar to the countryside in Egypt. It's very highly populated.
Yes.
But all over the country. So I think this is what happened first. And when this happened, there was so many cases and so many chances for the virus to infect people. So it's like, as I told you, it's like chicken and egg. The more you give the virus a chance to spread, it starts mutating. So in India now there is a new mutation in the virus. But as I said, maybe when I met you last year in the same program, viruses
Yes.
always mutate. So every time you give the chance to the virus to spread, it will generate new mutations. The only way to stop the virus from mutating is to stay home, isolate when somebody is sick, so that they don't infect another person, and this will not give will stop the mutation.
Yes.
But as long as the virus is spreading, it will keep dividing and making some mutations.
Yes. So, sir, do you think that we are now in the peak of the virus these days, and do you expect the numbers to drop in the coming months?
So it's very hard to.
Yes.
It's very hard to predict this because it all depends on our behavior. Again, I honestly don't see people alarmed around me in the street. Like this time last year, April 2020, we were all staying home. We were watching TV and staying home and doing Zoom meetings. Now there is more and more people in the malls and meeting each other and having meals together. So this is risky. To make a break in the peak, we have to stay home. And this is a time actually of a very high incidence in the entire world, except for the few countries that have mass vaccination. So we have to be careful and patient. It's much better than before because we have vaccines. So just make sure, try to take your vaccine and schedule it.
Yes. So now, in your opinion, the only solution for this problem is to vaccinate people and to stay safe. This is a wrap-up of what you've just said, that people should change their behavior and start looking for a vaccine to take, right?
Yes. Yeah, so at this time, the only solution is both taking precautions and taking vaccine. But we are always hopeful, maybe in a month or two, you will also have a third option, which is a treatment. So some companies are trying now
for treatment.
Spray.
Yes, this is good news.
Yeah, so treatments are still, it's harder to find a treatment, so it takes more time than vaccine. But hopefully it will happen.
So do you believe that someday there might be a treatment for this? Are there researches going on for this?
There is a couple, 2 or 3 companies that announced they have
treatment,
new drugs that are in phase 2 trials, it means maybe hopefully in 6 months or shorter we will have a better treatment. The other hope is to have a vaccine not only for this virus but for so many coronavirus.
Yes, and
if they make this vaccine, then we will be able to avoid any coronavirus in the near future, which is better.
Yes, and there is news that Egypt will have its own factory that will manufacture the vaccines here in Egypt. So
yes, this also is another thing because we are 100 million.
Yes.
So even with all the vaccines in the world now, we still need more.
Yes.
And Egypt has had one of the earliest vaccines in the laboratory, but it takes some time to manufacture it.
Yes. So finally, I'd like to thank you, Dr. Ramy Aziz, Professor of Microbiology. Thank you, sir, for being with us. And dear viewers, short break, and we'll be back, so stay tuned.